with Dr. Rob Melillo, and this is another incredible opportunity to talk with a living legend of chiropractic, one of the foremost, not only chiropractic clinicians in the area of ADHD, autism, and chiropractic neuroscience, but a published author in the area of chiropractic research, a textbook author, best-selling author, an amazing clinical master, as well as the founder of the Melillo method. This is a true humbling opportunity for me to share with you great thought leaders in the chiropractic profession. Dr. Rob, it is always an incredible, humbling experience to be with you and a wonderful opportunity to learn. Welcome.
Oh, thank you. As always, it's such a great honor to be with you. And these are always fun. So let's get into it.
They really are fun. I mean, I love learning and I love being able to grow as a chiropractor. And I think nobody brings knowledge to the forefront the way that you do. So I think people listening to this are going to realize, as I've continually experienced with you, that breakthrough information, knowledge, and understanding that you bring to a conversation is going to level up their practice. And as we're going to be talking research today, in particular, amongst all the things that you bring to the table, you are an incredible researcher and have done so much for the chiropractic profession, bringing research to the table. And I know you've got some incredible breakthrough content and research you've done recently. I'd love for you to share that and what's happening with your research at the moment with our audience.
Yes. And you just mentioned a statement that I think is important, that, research is great, but it's got to have a practical application in someone's practice, right? It's got to make a difference in how you treat people. And, that's been really the foundation of my research. I think, one of the things I'm proudest about is that I've really been able to combine the clinician, which I am a clinician. I'm still in the trenches every day, working with the most difficult issues. You may hear a lot of screaming going on in the background because every day we're working with the most difficult cases we can possibly get our hands on, and we're changing them in ways that nobody is. The demand for this type of service is growing so rapidly, and there's very few people out there that are really dealing with this at this level. And this is in all ages. So, one of the things I've really been focused on that I think really has tremendous application into chiropractic practice is the idea of primitive reflexes. Most people have some sort of peripheral knowledge of primitive reflexes. Some schools teach it, a lot don't. And if it's being taught kind of superficially. And not just for chiropractors, but, it used to be something that was a mainstay of pediatricians. They don't do it or really learn it much anymore. Pediatric neurologists still look at them, but, their understanding of them is very minimal. So, for me, I think when you're talking about, chiropractors should be the main people that are the guardians of the development of posture and of the brain and the nervous system. I mean, I think that we should be the most important people that work with those things and that understand them. And for me, being able to make a difference, there's nothing like understanding retained primitive reflexes. And that's where a lot of my research has gone. And like anything else, when you come out with something that's relatively new or a new understanding, you really have a responsibility to prove it, right? So, over the past 3 years, almost 4 years, during COVID, I've been doing a doctoral program in cognitive neuroscience, and the primary focus has been looking at retained primitive reflexes and autism throughout the lifetime. So in children, adolescents, and adults, we've been doing a randomized age-matched controlled double-blind study with a second tail to it in looking at retained reflexes in people with autism and understanding the role that retained reflexes play in hemispheric development and integration and functional connectivity. And we've looked at it as a 12-week study where we trained parents to do simply two things. One is we taught them how to stimulate primitive reflexes in a way to get rid of them or integrate them, and also gave them a TENS unit to do hemispheric-based somatosensory stimulation to the brain, and in particular to the right hemisphere in autism. And so 12 weeks before and after, we did a battery of neuropsychological tests. We did very high level QEEG, looking at brain and brainwave activity. We also looked at functional connectivity, and we did some fMRI, and we did that before and after. And so all of that data is now collected. We will be publishing that data in the next 4 months. We have 4 papers coming out. We've already published in the preliminary, I think I published 5 or 6 papers in the last 6 or 7 months. 2 days ago, I just came out with a paper on the really high level understanding the functional neuroanatomy of autism. And I think it's one of the best papers I've ever written. And we are really coming out with certain statements that really are unique, but really come from years of understanding. And so, real quickly, what the study results are showing is that we're documenting that people with autism that have retained reflexes. Let me take a step and just say, what are retained reflexes? Maybe people don't know. And so we're all born with what's called primitive reflexes. Things like the Moreau, the rooting and sucking reflex, the grasping reflexes, startle responses, asymmetric and symmetric tonic neck reflexes, spinal galant reflexes. Obviously, by the nature of what we're talking about, chiropractors should know about these, right? And many of these reflexes are believed to be there initially to help the child birth themselves and help them rotate. But primarily we have them because, human brains are the most immature brains on the planet at birth. We have, the largest brains essentially of all primates, and with the smallest birth canals. So that kind of is a trick. That means our brain has to really not grow much until we're out of the womb. And then there's this explosive growth over the next 3 years that is really brought on by environmental interaction, by being stimulated by senses. And that is all driven by motor activity. We have to move. The reason why we have brains on this planet is because a living thing moved under its own power. And so in babies, the way that we initiate brain development is through movement, but yet we don't have any control over our movement when we're born. We don't really even have a motor cortex when we're born. So how do we move in some sort of purposeful way? And in the brainstem, we have these things called primitive reflexes, and they are there to initiate movement and engage our senses, which then activate genes called experience-dependent genes, which then build the brain and form the basis of networks and create all the brain waves and all of the things that we know. And it gets us to roll over and then crawl on our belly and then crawl on all fours and then get up and cruise along the furniture and then actually walk at 1 year, which is when we're supposed to walk. And those stages are important. Recently in the United States, the CDC came out with, new guidelines that actually said that crawling is no longer a milestone, right? Which is going to be, is a byproduct of the COVID era debacle that we've seen from the CDC, right? And it's absolutely ridiculous because I talk a brain developmental blueprint. There are these stages that are built on evolution that we need to go through to build the foundation of our brain. And we build from the bottom up, literally starting in the bottom of the brainstem and then like building a building floors on top one another, and eventually building the brain and growing out and creating a prefrontal cortex. And then that brain comes down and regulates everything. And the brain controls everything. It controls the immune system and the autonomic system and all of that. So primitive reflexes are what initiate that and allow us to get to the point where we now start walking at 1 year. And then at that point, they should go away. They should be integrated and inhibited and should not be there any longer. The right brain is developing first in the womb for the first 3 years. And if those reflexes don't go away, what happens, and what does that mean, right? So that's one of the questions we wanted to ask in my PhD was, first of all, can they be retained beyond 1 year? Because in traditional medicine and pediatrics, they say they cannot be retained beyond 1 year, which is kind of a ridiculous statement to begin with, because they never look at it. But we know that that is the case, but we documented that we identified primitive reflexes using, and I have a team of neurologists, medical neurologists that are part of my research team. And we were able to show that, yes, there are primitive reflexes in children, adolescents, and adults with autism. But what does that mean when they're retained? What does that mean? And what we're able to show and prove is that it means that the brain stays in an immature state, that there's a maturational delay. And then what we also know is that most of the time, these reflexes are retained in an asymmetric way, where they're more on one side than the other. There's been a lot of people talking about primitive reflexes for the past 30 years, but no one has ever really addressed that question, which is, what does it mean when the reflexes are asymmetric? And what we've been able to show is that it means that there's not only a maturational delay, but there's a maturational imbalance in development between one side of the brain versus the other, which actually sets up this developmental imbalance, which is the core of my work, called functional disconnection syndromes. And depending on whether the right brain is delayed and the left brain is more advanced, or vice versa, and then depending on what networks and Brodmann areas are involved, can really describe every single issue we see in neurobehavioral disorders and mental health disorders in adults. So, my research, what we've done is looked at this, and what we've shown is that in children, adolescents, and adults, that there was an over too much of delta and theta waves, which are very immature brain waves. They're slow brain waves, but again, brain waves start out slow. And especially in the right side of the brain, again, which is a sign of immaturity. We were able to show that after our 12-week intervention, that there was an increase in alpha and gamma and a decrease in theta and delta, especially in the right hemisphere. And that we also showed that, which is well documented in autism, that there's an overabundance of short-range connections and too little long-range connections. And we were able to show that we could reverse that in 12 weeks, where we could increase the amount of long-range connections and decrease short-range connectivity, which again is a byproduct of normal maturation. So, this research is now complete. We're going to be publishing this information. And one of the really exciting things we also showed was that we also did EKG leads on all of these studies before and after. And with very sophisticated software, we were able to measure heart rate variability. And we were able to show that in all of the subjects initially, their heart rate was high, their heart rate variability was low, and that we were able to reverse that, where their heart rate went down, their heart rate variability went up. And if people don't understand what heart rate variability is a measure of, it's the most accurate measure of sympathetic and parasympathetic balance. So we showed that people with autism have an increased sympathetic tone because of immaturity, and that we were able to reverse that. And obviously that impacts all of the other things that we see in autism that are well documented, like leaky gut and inflammation and problems with detoxification and immune dysregulation. All of the other autonomic and metabolic issues that we see in autism can be explained by an imbalance in parasympathetic and sympathetic. And we showed that we can change that in a positive way. So these are really, really powerful things and really powerful findings that I think have tremendous application in chiropractic practice, because every chiropractor should know how to assess for primitive reflexes. Every chiropractor should know how to integrate these reflexes and teach parents or patients how to integrate their own reflexes. It's relatively easy. I've developed a way that is basically foolproof and incredibly effective. And now, we have the proof of it.
This is so incredible. And I'm gonna give a thought to this process. I'm going to come back and talk about how to integrate those in a moment with you, because I know there's some incredible information you've got to share in relation to that. Before we get to that process, so stay with us, everyone. We're going to talk about how to learn to integrate these processes. My thoughts, though, as you spoke about this, Dr. Melillo, was 28 years ago, I did a course with Reza Samvat on retained primitive reflexes, and then Dr. Keith Keane, and neither of those teach anymore in Australia. So this may be something that, even though I was doing retained primitive reflexes from a chiropractic lens and viewpoint, and most people might think when they hear the term retained primitive reflexes, and thank you for giving that in-depth understanding and explanation of it, because oftentimes we feel that it's a purely pediatric phenomena that, as you said, delayed maturation. It may seem that they're not crawling because of this, or maybe there's still evidencing elements of stress in their nervous system, so they're not latching on, and therefore the sucking reflex is problematic. So it seems for many people that retained primitive reflexes is a pediatric phenomenon, that needs to be addressed early on, which obviously it does, and chiropractors should be foremost in this, but it can also persist because of brain maturation interference. It can affect their learning, their behavior, their education. We can see these even in adults with tonic problems within their neck muscles, and wondering why they have these neck tension aspects, or why they consider themselves poor learning. So it's not only linked to autism or ADHD behavioral aspects. This is something we see in the adult population because of that maturation issue. And the beautiful thing about chiropractic is, if we know and understand retained primitive reflexes, the high-level neuroanatomy associated with it, we have the opportunity to analyze and detect the presence of these factors that are influence not only our brain maturation, but our ability to adapt to our environment. You spoke about heart rate variability, which we have spoken about on this podcast on a number of occasions. Our adaptive capabilities and our cognitive reserve is also impacted by this. So how we operate in the world, not only as adults, but how we even parent our children, can be influencing these developmental pathways, impacting the trajectory of the child's life, but the harmony of an entire family and the effectiveness of a person within their community. This is such a profound insight for chiropractors and an influence across the broader spectrum. Can you talk to what you are not only seeing in your clinic, and what other chiropractors may be seeing because of this retained reflex phenomena, and a lack of awareness, not only within the community, but the general health practitioners or medical practitioners, and what that means for chiropractors with their ability to, having found this, being equipped and skilled, as we'll talk about with you in a moment, and then provide an intervention. So how is it going to change patients' lives? What are we going to see, and what is it going to mean for them?
Yeah, so important. I'm so glad you brought that up, because, again, for me, research, I look at autism because it is the most challenging issue in any issue in neuroscience, right? And so for me, that's why I jumped into it, because I figured if I could figure that out, I could figure anything out. But, a lot of people may have no interest in working with children with autism or adults with autism, and that's fine. But like you said, what we have learned is applicable to everything. First of all, every mental health issue in adult, we now know really starts in childhood. And so, whether you deal with anybody, even in the mental health world, like anxiety is huge right now, depression, memory problems, cognitive decline, even neurodegenerative issues like Parkinson's, ultimately, most of it is going to start in childhood. And how does it start? It starts with retained primitive reflexes, 100% of the time. And what we've shown in this study is that primitive reflexes, if they don't go away in year one, they never go away on their own. They never self-correct. And I can show you videos, and we always demonstrate in class how, we can pick out, a chiropractor in the class that may have all of their primitive reflexes there, and they're very high level and high functioning. and they may still have struggled their whole life with a number of issues. And it may not be mental health issues. It may be chronic gastrointestinal problems, eczema, autoimmune issues. It may be, like you said, because there's research showing that retained spinal gland is related to scoliosis. That when we're dealing with asymmetric and symmetric tonic neck reflexes that are foundational to the movement of our neck and our spine, and also help to build the vestibular system, that if they don't go away, or if they go away on one side and not the other, they can cause chronic neck problems, back problems, shoulder problems, that they have so many applications to everything. And they're so simple to look at and so simple to work with, that, it should be a part of everybody's exam on any age. And, when people come in, one of the questions that you should always ask yourself is, when someone comes in with any sort of chronic illness, even if it seems acute, is ask yourself, did this just start now when their symptoms started, or is this the end range of a longer process? And maybe a process that's been going on their whole life. How do you know? Well, one of the things that gives you a clue is obviously their health history. And they may say, yeah, I'm really struggling with these problems now, but I've had them since I was a child. Or actually looking and saying, do they have retained reflexes? If they have retained reflexes, then their nervous system has never fully developed. Their nervous system has never reached its optimal level. And if these reflexes are asymmetric, then they absolutely have a hemispheric imbalance. And again, depending on which sides you're working with, that explains most of, if not all, the symptoms that they have. When people come in and they have all of these symptoms that seem confusing and don't seem to have any relationship, when you step back and if you really understand the way the right and left hemisphere regulate every aspect of our body, brain, and cognition and emotional regulation, and you look at it from that perspective, it incredibly makes sense. A very famous neuroscientist who's very skeptical, a guy named Tim Brown, actually said there's nothing in human psychology or psychiatry that, doesn't involve abnormal asymmetry of the brain. It's just that you have to look at it in light of that, and look at strengths and weaknesses. And, it's just, so in every patient population, you should be looking for reflexes. And if they're there, you need to address them. And what I see is many people that take my course that didn't realize that adults could have primitive reflexes retained. When they go back to their office on Monday and they start looking, they come back to me and go, I cannot believe what I'm finding. And of course, many of them are in the people that I wasn't able to get better, right? I knew there was a piece missing no matter what I did. And this is the piece. This is the most important piece. And understanding that, our brain as an adult, the fate of the adult brain is what happens in really the first 6 years of life. And if our brain doesn't develop, and understanding that the people that are most susceptible to retain reflexes and imbalances in their brain and nervous system are the ones that are most gifted in areas. So people that are PhDs, people that are highly intelligent, people that are highly gifted, in their right brain with art or music or athletics, or incredibly, empathetic and social, those are the people that are most likely to have dyslexia. 50% of people that work in NASA supposedly have dyslexia because their visual 3D spatial skills are off the chart. Thomas Edison had dyslexia. I've had many great athletes and musicians that had dyslexia. On the other hand, you get people that have these huge left brain skills that are highly intelligent. It's been shown that in families of autism that, there is a high number of professors and physicists and mathematicians and engineers, and it's referred to as an intellect trait because they're highly intelligent. So people that are professors and, you know, anywhere in the world, Simon Baron-Cohen showed out of Cambridge that anywhere in the world there's a cluster of people that work in the IT industry, that there's an explosion of autism there, because there are all these left brain dominant people working together and having children. And, you know, in Silicon Valley, it's like 1 in 5 now. And, you know, there was a recent study from a recent statement by an MIT researcher that said by 2025, they believe that 50% of children in the United States will have autism. I mean, these are huge numbers. These are big issues. To understand why, understand what autism is. The first question I ask people that come from all over our world to see me, the first question I ask them is, you've been all over the place and spent thousands and thousands of dollars. Has anybody even tried to explain what's happening in your child's brain? And they all look at me and say, no, you know, and I tell them that's where we start, right? We understand it. And I just published, like I said, 3 days ago, one of the most, I think, significant papers on the neuroanatomy of autism. And it doesn't mean you have to do anything with autism. It's all about the brain. It's all about the nervous system. It's all about development of that. And no matter what we're working with, for me, that is the foundation of chiropractic. It always has been from the beginning of time.
Yeah, it's incredible. Now let's talk on autism, because you said if those statistics are right, and we are seeing, the statistics have continually increased, and if we're now going to 1 in 50, I mean, I remember when it was 1 in 100, 1 in 75,000 to 1 in 100. It's just continuing to become a real epidemic, if not something so significant. The ability to understand what autism is, to have a clear, not only a neuroanatomy picture of it, but also a clinical understanding, as well as a therapeutic application to have an impact. I want to ask this question because there'll be many chiropractors who think, yes, look, we also people with autism. We know that there are people on the spectrum, but what can we really do? Because there's been some level of damage to their brain, to their nervous system, their ability to adapt to their environment. So isn't there some level of permanency of damage? Can interventions like chiropractic or laser or otherwise actually help and be effective? And I want to, I guess, ask that question because there is no one better to answer that than you, because the miracles that are being performed within your clinic are the answer to that question, but not everybody is aware of what's taking place clinically with what you're doing and what we're seeing in the world of autism.
Yeah, so my third book was about what causes autism, or more precisely, what elevates the risk of having someone, a child with autism or some other disability, right? And why is it increasing? And is it increasing? And are we facing an epidemic? That's really the first chapter. And clearly we are. Only about 50% at most of the increase that we see, going from 1 in 10,000 a little over 30 years ago to now 1 in 36 and really 1 in 23 boys, can really be explained by a greater awareness or diagnostic changes or any of that. So that means that at least 50% of the increase is completely unexplained, which means it's real. And what most people don't read is the two biggest misconceptions is there is absolutely no damage, physical damage at all, in an autistic brain. In fact, what we see is they have areas of their brain that are more connected than most people, but not in a pathological way, but in an immature way. Also, there is no genetic mutation in the vast majority. So there's only about 10% of kids that have what's called syndromic autism, which actually have some sort of genetic syndrome. And, so that's like Down syndrome, Fragile X, tuberous sclerosis, Landau-Kleffner, or some other mutation that we haven't identified yet. But to me, that's not really autism. That's really a genetic disorder with autism features. 90%, there is no genetic mutation at all. So there's no genetic mutation. There is no pathology or death. This is why it's so mysterious. This is why people don't understand it, because essentially when we look at the gross anatomy of the brain, it looks perfectly normal. We look at their blood tests, it's normal. We look at their genes and it's normal. We look at their metabolism and for the most part, it's normal. And this is why, and I hear this every day, people have been through all of these tests, EEGs, MRIs, and they come back and everything's normal. So then there's no answer from anybody in the traditional medical world, because neurologists are looking at organic medical illness, right? Organic neurological illness. If it's not something that you can see or measure with an MRI, or, a tumor, or, a stroke, or a clear brain injury, or a genetic mutation or metabolic disorder, then it's outside of their realm of expertise. And I work with many neurologists, and they fully admit that, right? This is where functional neuroscience comes into play. Who is supposed to deal with that? People that have clear neurological symptoms, but yet there's no clear organic neurological illness whatsoever. To me, that is chiropractic, right? That's what it was founded on. A guy like Gonstead, where people would fly in from all over the world with every type of psychiatric disorder and skin disease and whatever, and they would help them. So I think that, this is where should definitely be a part of what we do. But like you said, even if you're just dealing with musculoskeletal issues, you have to know about primitive reflexes and the impact that retained, and especially asymmetrically retained, reflexes are going to have on postural development, vestibular development, oculomotor development, and the nervous system. And if you're someone that deals mainly in diet and nutrition, and you understand the importance of what heart rate variability means, then you understand that, how do you change that? And in a measurable way, and why do you need to change it? What's the problem to begin with? So, all of this is really powerful and integrated.
Absolutely. And I think if you were a chiropractor and you are seeing patients, clients, practice members, whatever term you use, and they have a nervous system, you need to know this information. And, Dr. Rob, I'm always so grateful to speak with you. And as we wrap this up, I want to let people know about something that you're doing here in Australia, which for me is so incredible. I'm going to be there. You're actually bringing this education at very high level to the chiropractic community and to the community at large. So I want to just ask you a couple of questions about a program I know that you're bringing to Australia, to share that with this audience. There's 3 events that you're doing, and they're one after the other, so it's able to be integrated into a person's calendar. The neurodevelopmental foundations, which is really both for parents, practitioners, patients, to really understand foundations of the nervous system. Neuro-parenting mastery, following up on that, which again is the patients and caregivers getting an insight into their parenting and the nervous system and the impact on their children and their family's health. And then you move into advanced clinical applications for the practitioners to level up. And these are from November 10th and 11th for neurodevelopmental foundations. November 12th for neuroparenting mastery, and then November 13th and 14th for the advanced clinical applications in Sydney, Australia. This is so exciting. Can you talk to that event, those different aspects, and what it means for not only chiropractors, but their patients? Because I've been telling my patients about this as well, because I want them to know and understand what you know and what I want them to know, but I also want to up-level my own knowledge and skills. So I think this is such a beautiful event, offering such a broad spectrum of understanding. Can you share a little bit more about what you're doing, what your motivation for this is, and what people can expect to experience?
Sure. I'm really excited about it. And my motivation, as always, is really just to make an impact, right? And just add value. I think, one of the things in any of my courses, I always, and we've talked about this, the idea of personal development, and it's not just about, looking at the clinical or the science, but it's also about, how do you impact the world? How do you make a difference in the world? And, it's all about adding value. So I'm always looking at how can I add value at a higher level, and I'll go anywhere. But last year, a dear friend of mine, Carlo Ronaldo, who's an unbelievable clinician and researcher. He has a PhD in the vestibular system, and he's a chiropractor, and he, was a diplomate in neurology. And we've been friends for a while, and I've just, been amazed by his work and his clinical skill. And he invited me, and we've been trying to do this during the whole COVID era. So we canceled it a couple of times, but we never gave up. And I ended up showing up in Australia. Now, I had some great experiences. Genevieve Keaton, if you know who she is, she's a friend, and she had invited me to conferences there before. And I'd also spoken in Melbourne at the the Australian Chiropractic Association. So I have a lot of friends and colleagues there, and it's always been a wonderful experience. But last year with Carlo, we did basically a mini version of my course. We did 5 intensive days, and we had an incredible turnout. I mean, we had like a couple of hundred, doctors in the room for 5 days, and it was great to really be able to share my info and really, get into it in deep and really give hands-on applications and instructions. And we videoed it, and I know a lot of people, that is still available. But we got such a great response from it, and people wanted more. And in parallel, over the past 3 years, I've had one of the most productive times for research in my career, and I've been working I just developed a new center over the past 2 years. So I've been, bringing it into my clinic at the highest level. And so, my combination of research and clinical skill has never been higher. I've also been working with a colleague of mine, dear friend, Dr. Peter Schreier. And, Peter, for me, is upcoming star, I think, in chiropractic, but in neuroimmunology. I mean, he studied extensively under Dr. Datis Karazian and a guy named Dr. Sam Yannick. If you don't know who he is, everybody in chiropractic should know who he is, because he's probably one of the leading minds in immunology in the world. But the idea of neuroimmunology, really understanding, how the brain and the nervous system and the immune system work together for development of both systems at the highest level. And, he has developed an incredible skill in the application of it. And I'm, combining with him, the idea of what I know about neurology. And, he's also been, someone who's worked with me for many years, and he owned, brain balance centers. And so, our mission was to also bring the highest level neuroimmune that no one really has talked about from an application standpoint. So all of this has been going on, and he and I have developed, I'm starting a new course that's known as Functional Developmental Behavioral Neuroimmunology. And that's starting here in New York next month. And so we've been working diligently. He's actually here with me right now from Atlanta, that we're working on this. And so all of this has been coming together. And so I wanted to share. There's so much new information, and we're getting results like never before. So Carlos said, hey, are you willing to come back? And I said, absolutely. So, we wanted to go and again, for some people, really teach them the foundations of my work. But then for people that already took my work and have really soared with it over the last year, we wanted to give them these advanced application tools that I haven't really taught to anybody, because they're so new and so, innovative. And so that's what we're going to be doing there. But also, I have parents from all over the world that follow my work, and we have parents that have taken my fellowship course. They are really interested in what we're doing. And we have a huge following of families in Australia who are looking for people that are trained in my work. And so we wanted to have, a meeting just with the parents so that we could answer their questions, and we could introduce them to people that are taking my course and learning the Melillo method and are really learning it at the highest level, so we can, bring those communities together, really just, again, help people and help one another. So I'm really excited about it. We're going to be there in November. And I love Sydney, and we had such a great time last year. My wife is actually going to be with me. She wasn't with me this year. And, just seeing Carlo and his family is going to be great. But also, the dear friends that I've had in Australia for years. And I'm looking forward to seeing you. Out of all the things we've done, we've never actually met in person. And I'm really looking forward to that. And I think it's just going to be, really, really powerful week. And again, it's going to make an impact, and it's going to add value at a level. And I'm just excited about it. I can't wait to do it.
Yeah, look, I'm excited, and I can't wait to see you. I'm going to be there. I've let my patients know about it, guys. I want you to be there as well, because if you want mastery level knowledge information, this is the man to deliver it. If you want to up-level your knowledge, skills, and ability, this is the opportunity for you. Sydney, November 10 to 11 for the Neurodevelopmental Foundations. Get the patients there because they need to have an understanding as well on Sydney, November 12 for Neuroparenting Mastery. And then if you want to up level to absolute mastery, no better person to teach this, Advanced Clinical Applications, Sydney, November 13, 14. I'm going to be there. Rob, I cannot wait to connect with you in person. I've been so grateful for the knowledge you've brought, not only through our events, but I have your entire library. And if you have not got Rob's books, go onto Amazon, look up Dr. Rob Melillo. He is not only a best-selling author, but they are breakthrough books and understanding. I'm just always in awe of what the amount of knowledge he has, one of the greatest minds in our profession. And so I'm excited. I want you all to share in this excitement to be part of this incredible neuroscience journey that Australia is getting an opportunity to have and to experience, and their ability to impact the health and lives of our patients, changing the trajectory of their life, because this is when we get these early subluxations addressed, we're altering the neurodevelopmental of the child, which means the pathway of their life. Chiropractic is a true gift to humanity. This is a great opportunity to be able to embrace those skills. Dr. Rob, always grateful, deeply appreciative. Can't wait to see you. Can't wait to be at that event and continue my learning. Thank you, my friend. I appreciate you so much.
Thank you. I look forward to it.